For decades, the pill has been the go-to method of contraception for women and girls. But the Canadian Paediatric Society this morning says that should change. In a report just out, it is now recommending intrauterine devices, or IUDs, as the first line of defense against pregnancy for sexually active teenage girls. Christine Burak this morning with the details on the Society's new guidance for doctors.
Say the words birth control and most people think the pill. Well, now the Canadian Paediatric Society is trying to change up the conversation, saying it now supports intrauterine devices, or IUDs, as a first line of defense against pregnancy in sexually active teen girls. While IUDs are the most widely used reversible contraceptive method in the world, that's not the case in North America. In the 1970s, issues were raised around a particular device, issues the Canadian Paediatric Society says have been looked at.
A concern that it would cause infection, but it turns out that those studies, or the interpretation of those studies, was flawed. And when people went back and re-looked at all of that, they realized that really, in fact, the risks were more related to having unprotected sex.
An IUD is often a small T-shaped device placed inside the uterus by a doctor or nurse. It works to prevent pregnancy for years at a time, so no daily pill, and it can be removed at any time by a healthcare provider. There is a small risk of tissue perforation during insertion and cramping afterwards. This Planned Parenthood helpline answers questions from teens.
The common question we get is, can I get an IUD without my parents knowing? And that's a question that we get a lot around a lot of birth control methods, but with the IUD, because you do have to go to a doctor, I think we get that question more frequently.
Pediatric Society says parents should talk to their kids about sex and sexuality in small doses to encourage them to ask questions, and also remind them that condoms are still the best protection against pregnancy and sexually transmitted infections. Christine Burak, CBC News, Toronto.
I want to introduce you to our guest this morning, a doctor who co-authored the statement, Dr. Josie D'Amelio, who is an adolescent medicine specialist at Montreal Children's Hospital, but not in Montreal right now, with me from Quebec City. And a pleasure to have you on our program. Good morning to you, Dr. D'Amelio.
Good morning, Heather. Thank you.
Can we begin? Let's just start with the position statement as you've issued it. The fact that you now are urging doctors to offer IUDs as a first line of defense against pregnancy for teenage girls. Why have you made that recommendation?
The intrauterine devices and systems are the most effective method of contraception that's available in Canada, and we want to reduce the number of unwanted pregnancies, unplanned pregnancies in youth.
Most effective, how effective, Dr. D'Amelio?
So the pregnancy rate range is well under 1 in every 100 women using the method over a year. And in contrast, the pill, the patch, and the ring are approximately 9 women in every 100 get pregnant over the course of a year, which is substantially higher, especially when you're a very young person, and a pregnancy can really alter the course of your life.
And what about condoms? As far as that list of efficacy, where do condoms fit?
Condoms are even lower. The failure rate is around 18 per 100. And that doesn't mean that we don't recommend the use of condoms. We think that condoms should be used with all other methods of contraception as a defense against sexually transmitted infections. And if youth are more comfortable using a hormonal method of contraception rather than the IUD or the IUS, then we're recommending that they definitely use condoms as well for contraceptive purposes, so that the two of them together actually, so using a pill and the condom together increases the effectiveness so that the failure is around 2 in 100 instead of 9 in 100 when you're just using the pill.
Okay.
So
a very
condom
great
has that dual role.
Right, and a very important role too for STIs as far as condom use.
Yeah.
But in terms of efficacy, we're talking IUDs and then the pill and then condoms.
Right.
So this is a significant shift in position and recommendation. Even
Yes.
If I'm to go back to my teenage years, my generation, early 20s, this was not something a doctor would ever recommend it to someone of my age, to a young person, to use an
Correct.
IUD. What has changed that you now are?
Are the understanding of the research that was done around IUDs has changed, and we now understand that that having an IUD doesn't increase your risk of infertility, and so that it became important to offer this as an option for youth. And this is something we've known for almost 2 decades, except that it takes a long time to get it out into the to providers and to help providers be more comfortable doing that. When a society like ours issues a position statement that clearly says this is safe to use in teenagers, then it helps providers, one, be aware that it's safe, and two, be at greater ease. So it's not just a random physician saying, go for it. It's the whole society.
Dr. D'Amelio, can I bring in a couple of viewer comments, because we've been having quite an exuberant exchange with viewers, and some have been writing to us, as Angela did. You'll see there that it has been a godsend to her. But more representative, something like what Barbara said about how she back in the 80s had a copper T and almost lost her life, perforated the uterus, an infection set in which went undetected for months. And I've had really countless notes this morning from women who had IUDs in the 70s or 80s, who had either perforations or infections, led to infertility, fertility treatments, and they're quite concerned that we're talking about complications being maybe some cramping here, that there really are far more serious problems as they themselves experienced it. Why are we recommending this now to teenage girls, not appropriate for teenage girls?
Yes. There is no method of contraception that doesn't have issues and side effects. So we're going to start with that premise. The perforation is a risk, but it's a very small risk. Certainly, if you're the person that it happened to, it's a terrible thing to have happened. Most of the time, these things are picked up right at the moment of insertion and dealt with. You take the IUD out, you monitor the patient, you treat any infection. Certainly all of these pieces of the healthcare puzzle need to be put into place, and people need to monitor their patients, and patients need to be aware that if they're having difficulties, they need to go back to their providers. But the pill is not without complications. The injection is not without complications, which are equally can be equally significant. They're just not things that happen very often.
Okay. Obviously, it's a serious discussion, regardless of the method being selected. So have that discussion with parents and with doctors. Now another option. Thank you very much for being with us, Dr. D'Amelio.